Sharing prescription medications with family members or friends who need care may seem like the right thing to do, even an act of kindness. But new research highlights the potential hazards of passing these medicines around. The American Public Health Association recently presented data that showed 25% of people who borrowed medicine prescribed for someone else experienced some sort of side effect, while 77% of prescription borrowers said they had bummed medicine rather than see a healthcare provider. And for many, it merely delayed the inevitable, and that's because 1 in 3 ended up seeking medical care anyway. A lot of people have focused on recreational medication sharing or abusive prescription drugs for a buzz. But what people haven't looked at is what we call altruistic medication sharing, which is you're not feeling so well, and a friend happens to have some extra medicine that treats symptoms similar to what you're having, and they let you borrow it. In another study, it was reported that 20% of U.S. teens say they swap prescription drugs such as antibiotics and allergy medicines with friends. The new study corroborates the frequency of drug sharing in America, with 1 in 5 admitting to borrowing drugs. Many people just think, it's no big deal. But depending on the drug, the dosage, and other factors, it can be a very big deal. Painkillers come in different dosages, and some combine an opioid with acetaminophen, which is the active ingredient in Tylenol. If the borrower is already taking over-the-counter Tylenol, he or she could be doubling the dose of acetaminophen, and that is extremely dangerous to the liver. But pain medications are not the sole cause of unintentional consequences. Sharing eye drops can result in the spread of infection, and giving out leftover antibiotics can result in unnecessary treatment or treatment with the wrong antibiotics. What if you are allergic to an antibiotic and the person giving you the medicine doesn't know that you're allergic to it? Not to mention taking someone else's anti-anxiety or antidepressant medicine without the proper warnings can cause unanticipated dizziness or sleepiness behind the wheel of a car. When it comes to prescription drugs, sharing is not caring.